Hello, this is David Rath. I'm a senior contributing editor for Healthcare Innovation, and I'm here with Dr. Subha Airan-Javia, who's an associate professor of clinical medicine at the University of Pennsylvania and the founder and CEO of a Philadelphia company called CareAlign that creates a collaborative workspace for clinicians to manage patient care. So welcome.
Thank you. Nice to be here, David. Great
Great.
to meet you.
Why don't we talk about what led you to create CareAlign while working as a hospitalist physician at Penn Medicine?
Yeah, so I actually would say that my path started earlier than that as an intern at Penn, where it became evident really quickly that the way that we practice is often inefficient and error prone. And I think like most interns, I was very impressionable from some of my senior residents who impressed upon me the importance of team communication. So I first became interested in handoffs and transitions and how we facilitate that. So CareAlign's ancestors were started as a resident. We created a web-based platform to replace how we were managing our team lists and handoffs. Long story short, that kind of morphed into CareAlign 10, 15 years down the road, but really it's an effort to reduce communication failures so that we provide better care for patients, while also making it easier for us as clinicians to do the right thing for patients. And I often tell our teams that we're human, we make mistakes, and unfortunately medicine is not an exact science, but we should be able to reduce or not make preventable errors, especially those that are from processes and tools that we should be able to change.
So let's take a deeper dive there a little bit into what types of handoff errors might happen in the clinical setting and how CareAlign solves those.
Yeah, so we started in the inpatient setting, and I will say that I had never even imagined that we'd bring CareAlign into outpatient and post-acute care, but it's the same challenges. And I think fundamentally it comes down to the fact that the way we practice medicine has changed. It's no longer that one person knows everything about a patient. We have dozens of different teams of clinicians and providers and disciplines that are involved in caring for patients, which is excellent because we are able to provide really highly specialized care. We're also making sure people aren't working 100 hours a week. So, those changes are important and needed, but it means that, a lot of times the left hand doesn't know what the right hand is doing. And EHRs and other, secure messaging have made a lot of improvements, but they really haven't fixed this problem of teamwork and how do we work together. So although we round together and we talk to each other, our minute-to-minute work is done in silos on paper lists. So it means that, a lot of the daily, what are you doing? What needs to get done for a patient? How are we getting this done? Did you get this done? Those are the things that get lost in translation within a team. It's then compounded when you think about between teams. So a consultant and a primary team, a nurse. And then it's exponentially even beyond that when you think about outside of a hospital setting. And now you have different healthcare systems, different practices, different outpatient providers who aren't even within the same technology stack, so they can't easily communicate together. So, I think part of the challenge is we don't think of ourselves as one broad team of all the different people taking care of patients. We're working in little smaller groups. So that's where, I don't know if that's specific enough, David, but yeah. It's really about what do we think is going on and what do we need to do about it? And right. How do we collaborate in real time about that?
But how does it relate to how the clinicians traditionally use the EHR for communication? How does it append onto that or yes. change that relationship?
Yeah, so the EHR is transactional, right? And the way we do our medical charting and documentation is it's episodic. The way we practice care is dynamic. It's constantly changing. I think that's where a lot of the mismatch is. It's also that we do a lot of our work not sitting at a computer. So CareAlign is really, it's an EHR connected application. It just works alongside the EHR. It can also work totally separately from the EHR, but it's providing structure and organization to what we're currently doing on printed paper lists, on Post-it notes, in email, in basket messages, and in secure messaging. These are all different pieces of us trying to kind of get on the same page with each other, but they're unstructured and separate. So CareAlign brings all of that together to say, okay, holistically, what are we all doing for the patient in the context of what we think is going on clinically? So, without CareAlign, people are in the hospital. People are using all those things, like I said, email, text messaging, pages, like pagers, and then printed lists where they're writing on paper and saying, hey, did you do that? In the outpatient setting, we're faxing letters to each other and then trying to make sure that we have it on the same within our chart. So that's really what CareAlign is doing, is providing this team workspace to bring all of that together.
Have you studied it in actual usage and what some of the benefits it provides to clinicians? Can you watch and kind of document that?
Yeah, so one of the advantages of being born within a health system and then being spun out is it's been in use now for over 6 years at Penn, and we've spanned both Allscripts, Cerner, Epic world, and then moving all to Epic. And we've now also been in other health systems where it's being used separately from their EHR. So usage has been, it's interesting. We start with one service and then it very quickly spreads to other services. So, unlike a lot of things which are designed for one particular specialty, CareAlign's used across specialties, across clinical settings, ICU, floor, inpatient, outpatient. But what we find, what I hear the most often is that we save people about an hour a day in getting their work done. And we've talked a lot about the team coordination. I haven't mentioned as much that the second big bucket of what CareAlign does is we create very intuitive, easy to access views of the data that we need from the EHR, vitals, labs, meds, the information we need to make decisions, and make it available at the point of care when we're making decisions. And so, the access to information, both that EHR information and the team information, is what really drives the improvement. So like I said, on average, people say they save an hour a day. They say they get their documentation done in half the time using CareAlign. My favorite quote was someone who said that we'd have to pry it from his cold, dead hands if we tried to take it away from him. That was an attending. But, I think the most significant thing is that the vast majority of people using CareAlign can each point to a time when CareAlign helped prevent an error in their own practice. So, they say they feel safer taking care of patients using it because they make less errors. On the flip side, we've seen, it's kind of like the quadruple aim. We've seen patient satisfaction and HCAHPS scores go up, and then all of that contributes to the hospital's bottom line as well.
Is there a benefit that you see on the hospital operator administration side?
Yes, I think that this is one of the really exciting areas, is that when I talk to administration, they often feel like what the clinicians do on the front line is a black box and they have no idea what's going on, which it often is because it's happening, outside of the once a day progress notes that they see in the EHR.
Yeah.
And I think what CareAlign can really do, it's actually on both sides, is it provides insight and transparency into what are we actually doing? What do we think is going on? How are we doing that as a team, which the administration can see and learn from. But then it means we can also help provide standardization and process improvement at a larger level. So just a very simple example was shortly after the pandemic started last year, people created these templates and bundles in CareAlign of these are the things we're doing for our COVID PUIs. This is what we're doing for people in the unit. This is what we're doing as people are coming in with suspected symptoms. And that was something that was changing, right? Every day, every week. And it would have been really hard to disseminate those processes widely without CareAlign. So within CareAlign, people made bundles and then everyone was able to access it, pull it into their workflow immediately and change as recommendations were changing. That's really hard to do when it's all siloed.
That's a great example. I saw you give a presentation a couple months ago with the Health Share Exchange regional HIE folks here in Philadelphia. Could you talk a little bit about how CareAlign works with health information exchange data?
Sure. So what we are doing with our regional HIE, which I'm very excited about, is connecting to their APIs to do what I just mentioned, which is make the data that's in the HIE available, more readily available at the point of care, and to really present it in a way that's easy for clinicians to make actionable. So, the HIE is such a wealth of information about patients so that we can, actually know what's going on, but it's usually in separate CCDAs or in individual documents. And what we're really doing is saying, let's present this information from a clinician's perspective. So if you have a blood count, I don't want to have to look at 20 different documents to see what it was at 20 different times. I want to be able to trend that across all of them. So we are, working with HIEs to make that data, I like to say democratizing the data for the clinicians and patients ultimately to be able to actually drive better decision making. So we're starting locally, but we already have requests from a lot of clinicians in other states saying, can you connect to our HIE and bring that data in? Obviously, there's a lot of just technical and policy related things to work through. But I think with the Cures Act and our recognition as an industry that we need to have access to data and more interoperability, I think that this is the right time to move that forward.
Okay. Well, this has been fascinating. Is there anything else you want to stress before we finish up?
I guess I would just say that, a lot of times people think doctors and clinicians hate computers or hate technology. And I think I can say for sure that that's not true. We love technology. We just don't like poorly designed technology. So, we really design for delight. We are by clinicians, for clinicians, and I'm specifically using the word clinicians to include everybody providing care for patients. But we often hear people say, how do I get people to use a new technology? You don't have to. People love it. They want to use it. And it's exciting to be part of that.
Great. Well, thank you so much for taking the time to talk about your work.
Thank you. Appreciate it. Have a great day.
You too.